Cardiovascular disease and disorders of other organs. Clinical findings in hyperthyroidism include constitutional changes such as nervousness, diaphoresis, heat intolerance, and fatigue, as well as cardiovascular manifestations such as palpitations, atrial fibrillation, and sinus tachycardia with a hyperkinetic heart action. Cardiovascular examination may reveal tachycardia, widened pulse pressure, brisk arterial pulsations, and a variety of findings associated with the hyperkinetic state. These may include a prominent S1, the presence of an S3 or S4 or both, and a midsystolic murmur along the left sternal border secondary to increased flow. When a particularly hyperdynamic cardiac effect is seen, this murmur may have a scratching component known as the Means-Lehrmann scratch. This is thought to be caused by the rubbing together of normal pleural and pericardial surfaces. Systemic arteriovenous (AV) fistulas may be acquired because of trauma, or they may be congenital. The increase in CO that such lesions create is related to the size of the communication and the resultant reduction in the systemic vascular resistance that it promotes. In general, systemic AV fistulas lead to a widened pulse pressure, brisk arterial pulsations, and mild tachycardia. The Nicoladini-Branham sign, defined as the slowing of heart rate after manual compression of the fistula, is commonly present. The maneuver may also raise arterial and lower venous pressure. Osler-Weber-Rondeau disease, or hereditary hemorrhagic telangiectasia, is an inherited condition that may include AV fistulas, especially in the liver and the lungs. The disease may produce a hyperkinetic circulation with abdominal brutes and hepatomegaly due to intrahepatic AV connections. Beriberi heart disease is a rare condition caused by severe thiamine deficiency that leads to impaired oxidative metabolism. It occurs most frequently in the Far East. In Western society, alcoholic cardiomyopathy may contribute to, or overlap with, this syndrome because of the tendency for alcoholics to become vitamin deficient. Patients with beriberi may present with a high output state due to vasodilation and increased blood volume, followed by eventual impairment of contractile function. Typical findings include peripheral neuropathy with paresthesias of the extremities, decreased or absent knee and ankle jerks, hyperkeratinized skin lesions, and painful glossitis. The presence of edema characterizes wet beriberi and differentiates this condition from the dry form. Carcinoid syndrome is an uncommon disease that results from the release of serotonin and other vasoactive substances by carcinoid tumors. Physical findings may include cutaneous flushing, telangiectasia, diarrhea, and bronchial constriction due to release of humoral mediators.